Okay, good morning, good afternoon. So, I am between lunch and you people. But it's a very important topic, healthcare waste management. It must be a big problem, managing the healthcare waste or the biomedical waste. It started with a journey from 1998 when we first time Government of India notified these rules as biomedical waste management and handling rules, 1998. And then few amendments in 2003, and then came to the revised version of the rules in 2016. They are called the Biomedical Waste Management Rules, 2016. And then another amendment came in 2018. So, to know about these rules, to know how to practice these rules in the hospitals without being penalized. So you know that there is a clause of penalty for violation of these rules. So your hospital should not be penalized. So how to practice these rules and how to follow these rules. And if there are any difficulties, you are most welcome to ask the questions. So first, let me introduce the panelists to you. All the three panelists are from on the online mode. So we have, first is Dr. Ruth Stringer. She's from the European side, UK and the developing countries. And then we have the Pieper, Dr. Pieper, and she will be giving her perspective from the WHO side. And then we have Dr. Malini Capoor, she will give the Indian perspective. So first of all, I'll start with Dr. Pieper. Good morning, ma'am. Can you give your perspective from the WHO point of view? What do you feel is the principles of healthcare waste management and how this process is being done?
Okay, so good morning, everybody from Berlin, Germany. I'm pleased to have the possibility to talk about the global perspective on healthcare waste management. As I'm working for the WHO WASH unit in Geneva since about 10 years, I would like to give you kind of an overview what WHO is doing in this perspective, and just to get this inserted in the work you do in your hospitals. So the first thing I would like to talk about is the globally major gaps in wash and waste and electricity, which are still there. When you can see the healthcare waste part, you can see that 2 in 5 facilities in the low-income countries lack basic waste services, segregation, and treatment. So you can see that there is still a big gap in healthcare waste worldwide. So although everybody is talking about it, but the implementation, the real enforcement is still weak. And these data are from the joint monitoring program, which is one of the monitoring tools which WHO is using. And this is done since the last years. So there's a comparison between 2000 and 2021. The document is quite interesting to read, especially when you see that that we still need to do a lot in this area worldwide. But how to do that? So there are a lot of health assembly resolutions for countries. You might have heard about the one from 2019, the World Health Assembly Resolution. Then from 2023, the UN General Assembly Resolution on Sustainable and Safe Wash, Waste and Electricity. All of them are calling the countries to establish national roadmaps and targets, also for going for IPC standards, to integrate WASH and IPC standards and indicators into the health programming and monitoring, to increase domestic funding for WASH and health facilities. You can see that WASH, so water, sanitation, hygiene, WHO and UNICEF included also waste in it, and now newly we will also include electricity within this unit. And the IPC are really interlinking and are overlapping in a lot of areas, so that we often have we need to work together and collaborate from these two units very strongly. The 2023 General Assembly resolution calls for greater integration with health efforts, and again, country to develop roadmaps and allocate adequate budget. So you can see from 2019 to 2023, it's still the same issues. So we are still not there where we want to be. So there's still a way to go. One of the tools WHO has is the WASH country tracker. This is a tracker which is tracking the progress done in the countries. So I just copied here the one from India. Yeah, so we have in the WASH area, yeah, so we have the situation analysis, the baseline assessment, there are national coordination available on roadmaps. Is there a WASH and healthcare facility standard? And here healthcare waste management standards available, the infrastructure improvements and so on. And here we have a traffic light system from green, which is practical step are completed, over yellow, orange, and red, and actually still there's a lot of countries are not applied because we did not receive any data. And this tool is also based on this resolution I talked about before. So this is really important because a lot of people think, all these resolutions, they are just there and it's just a lot of talking but no action. But that's really not true. So the health resolutions are really pushing the UN organizations and also the countries to work into a certain direction and to implement the strategies accordingly. This is a brand new document which has been recently issued. It's the UNICEF WHO Global Framework for Action from 2024 to 2030. It's for wash and waste and also electricity services in all healthcare facilities. And the aim is to achieve essential climate resilient and quality health services. So I just copied some of the exemplary activities which are really focused more on waste as well. So to update the national standards from the baseline 2022 to 2024, it's 75% of the countries aiming in 2030 to have 100%. So the aim here in this framework is always to have 100% in 2030, and just have a look, 2030 is not a lot of time to accomplish all these activities. Yeah. So here to develop implemented costed roadmap. So I'm underlining here the costed roadmap because to have real budget available is in a lot of countries really a difficult issue. To monitor and to secure sufficient financing of services. So these are the main parts on waste. And it might not be a lot of activities, but still to accomplish this till 2030, it's 5 years, maybe 6, yeah. And then we should be there. And I'm really curious how far we get in these cases. Then I would like to highlight also one of our core tools to assess facilities and to plan for improvement. This is called the WashFit tool. It's a risk-based quality improvement tool discovering the wash areas, but also healthcare waste. It has been used in over 75 countries, and it can be used on facility level, also primary facilities. It was made for primary facilities, and now we expand it to also secondary, to make a step-for-step approach to improve all these areas in wash and waste over the time. Another tool I would like to highlight is here the Open WHO course. So there are training courses at the Open WHO webpage, easily available on different areas. And one of them is the IPC. There are different courses on IPC, and one of them is the standard precautions on waste management. This is a one-hour course, and after the course you will get a certificate. The brand new one is a WHO course on WASH, which has been launched right now in September 2024. And also here you have courses or modules on the different areas on water, hygiene and sanitation, but also one on waste management. So all these sources are available, easily available on the web pages. I don't want to go into detail here, but we have from WHO a lot of different guidances available. This one is the Blue Bible. It's a really comprehensive guidance from cradle to grave, getting all the issues, what you want to know. From the perspective of WHO, of course, it's the national regulations is something completely different. But this is the most comprehensive one with more than 300 pages with a lot of details. We have also a summary document of this because it's really very difficult to read. But if you want to start working on healthcare waste management, there's a summary of that which can be easily read. Another one, what I would like to highlight is the overview of technologies for the treatment, where we have a ladder system of the different treatment systems from incineration, but also going for alternative treatment technologies like autoclaving and microwaving, and what kind of requirements you need to install such equipment. So here we can see the ladder of this document from the low heat based and chemical based processes and the dual chamber incineration with flue gas treatment in accordance to the Stockholm Convention. These are the two areas which are recommended by WHO, down to the ones which are not recommended, like burning in a pit and open burning. So there are clear statements on that now available. So at the moment we are updating a document on the management of pharmaceutical waste. This is really the process at the moment. So we are hoping to publish this document on pharmaceutical waste management last quarter of 2024 or the first quarter of 2025. So here are the steps. We are an overview of the steps, what we did in the last years. From 2019, the global baseline and guidance from the strategic action, what I said, the Health Assembly resolution, up to now, this framework for action, and then hopefully in 2030 we will accomplish all the activities we have focused here in the global framework for action. So thank you very much. I hope I could give you a short insight in the work WHO is doing. So I really call everybody for coordination in the different areas of if it is UN organizations, the countries, the health facilities, also the different areas in the health sector or in the environmental sector. It's really important to talk, to communicate, and to coordinate. And so it's very important to have such meetings like you have at the moment. Thank you very much for listening.
Information from the WHO perspective. Now we move to Dr. Malini. She will be giving the Indian perspective. And I would request Dr. Malini to give just an overview of what the government of India is doing, what the state governments are doing, and what are the core principles of healthcare waste management in India.
And from Healthcare Without Harm, we have Dr. Ruth for agreeing to discussing this important issues related to healthcare waste management. And I would start my session. Thank you so much, IFCAI, for this very beautiful sessions. And then we planned out the session, how it should envisage the global perspectives, the developing world, and then the Indian scenario. So my topic is on healthcare waste management, the rules and guidelines, And you're all aware that India is signatory to the Sustainable Developmental Goal in United Nations, and we have to achieve them by 2030. And waste management, water, sanitation, they are important Sustainable Developmental Goal are number 6. And then you have the AMR in Sustainable Developmental Goal, and they are interlinked. And since India is also signatory to the Stockholm Convention is to decrease the dioxins and furans. So we are shifting from the burn technology, we have shifted to certain non-burn technologies like autoclaving, and the whole idea of waste management is circular economy, to have such practices so that, the waste is managed from cradle to cradle instead of cradle to grave. And then if we talk of healthcare waste, we need to focus not only on biomedical waste, which is there in the healthcare facility, we need to focus on the e-waste also, which is there with the automated equipments, the hazardous waste, what we see in the laboratories, the general solid waste or the municipal solid waste. We also need to focus on the construction and demolition waste. We have so much of construction going on. And then plastic waste, yes, plastic is also increased in the hospitals. So if we go back to the history, I would start, like in early part, we had less number of healthcare facility, less number of the waste being generated. Then came the HIV, drug resistant, Bhopal gas tragedy, and then the environmental laws in government of India got in, and then the radioactive waste, the hazardous chemical, and then there were 2 independent writ petitions, one in New Delhi on the biomedical waste, and there in Mumbai for the solid waste, and then came the, the biomedical waste rules. But we do have, wake-up calls, like this was the largest survey on healthcare waste management conducted in India, that was Incline survey, and which warranted that, the healthcare waste management system should be, the rules should be strengthened further, more accountability, duties of all the stakeholders, more green technologies, and, from cradle to grave, we need to have cradle to cradle approach. And then there were outbreaks which were going on due to reuse of needles. So we had, to strengthen the laws, and we had the introduction of the 2016 rules. And then COVID was a big eye-opener. If you don't manage your general municipal solid waste or anything and everything touched by the COVID-19 patient, especially first 2 months of the COVID outbreak, we saw that 2 to 3 months, it was dumped as biomedical waste. So both streams should be strengthened, and this was happening globally. And then CDC in March came up with the category of waste that it's not a category A virus. So we have various rules and guidelines in our country, but what important point is that what needs to be there in biomedical waste rules, and what important implications the other rules have on biomedical waste rules. That's also very important, because plastic waste management rules got notified. So what are the important implications? What are the disposal bags? They should be, more than 50. Then when plastic waste management rules got notified, 75 microns. So we have enough legislations and guidelines, especially the 2016 rules. They focus on the WHO core principles of with the best available techniques and the best available practice, and keeping in mind the Stockholm Convention, which Government of India is signatory. And so we have these policies and, guidelines coming up from Ministry, from Central Pollution Control Board. For COVID, again, we had separate, guidelines for immunization waste guidelines, because when Government of India took the mammoth task of immunizing, the whole country related to COVID-19 vaccine, then immunization waste guidelines came up. And so in healthcare, solid waste is also important. Then if you're a large tertiary care, like, All India Institute of Medical Sciences, Safdarjung Hospital and other hospital, then you need to have certain good, practice like composting for the solid the municipal waste. You can have composting pit also, but if your healthcare facility is large, you need to have these large composting machines, what we have in your hospital inroads also, you need to segregate the general waste, that is municipal solid, and which is biodegradable and non-biodegradable. We have a material recovery facility in hospital which separates even this waste also. And then you have the hazardous waste in the hospital. You have the lead waste, they are given to the authorized recyclers by the State Pollution Control Board, whether it is lead or mercury. And radioactive waste, we have a separate rules, and these are very, very strict. The hospital is not certified. If you have a nuclear medicine department which does not have these rules, that is 10 times the half-life of the isotopes. Then the automated equipments used in the hospital have a lot of e-waste. E-waste is covered under extended producer responsibility, and your hospital needs to have an, rate contract with the State Pollution Control Board authorized recycler. This is our e-waste we have implemented in our hospital, the e-waste management rules. Then, the plastic waste management rules say that the use of single-use plastic devices should be prohibited, and we have implemented that also in most of our canteens. At least 80% implementation is there. But in healthcare, we have single-use devices, and the use of single-use devices, that also adds to the plastic pollution. So if you look at the hazards, I will not go into the detail. You have the infectious diseases, endocrinal disruption, air, land, water pollutions. You have, of course, punishments. You have antimicrobial resistance due to this, and multi-drug resistant organisms have been reported in various, the water bodies, rivers also. The antibiotic residues have been reported, and there are so many reports that how the cancer incidence has jumped. And fourth most common cause is environment. So you need to take care of the effluents which are going down. Government of India has laid down the continuous monitoring of the effluent treatment plants, that is by these monitors which are their online monitoring system, where the State Pollution Control Board is monitoring right in real time basis what is the parameters of the hospital effluents, what are the levels, BOD, COD, what are the metals. And you need to have them hospital, if your hospital is big, hospital monitoring environmental group should be there, which takes care of these sustainable practices in the hospital, like the rainwater harvesting system, solar water heating system, the effluent treatment plant, so many. And this is the license authorization with the consent application, which is granted only if you follow the biomedical waste rules and take care of the environmental practices and environmental monitors, like the effluent treatment plant, rainwater harvesting system. So Government of India has included that in the Swachh Bharat Abhiyan, as a result of which we have repeated assessment, and this is necessary. And if you look at the standard precaution, the wash and biomedical waste management, or the healthcare waste management, is given, it is the last point, but it is neglected worldwide, not only in developing countries, but in other countries also. We are taking care of standard precaution, the first 9 points, but the last one is often neglected and an important public health problem worldwide. We have rules and guidelines, okay. We have the guidelines on the rules which delineate like what is the biomedical waste or the general solid or the e-waste, and how do you segregate them. Then, these are there, but you need to upgrade your hospital policies, your hospital NABL or NABH manual, or the NQAS manual, and the SOPs, and the waste management chart, the categories of waste in that. And mind that if it is not a category A virus, any pandemic which comes up, separate your healthcare and the general waste stream. So you need to have a robust team, you need to segregate on site, then transport the waste to the common waste site, and everything is monitored through the barcoding app by Central Pollution Control Board. Then it goes to the authorized vehicle, the authorized agency, and there it is further scientifically managed. Only the lab waste is pre-treated, and then you have separate guidelines, like in the biomedical waste rules, like as per the MTP Act, the fetus, how it should be disposed, then how the bags are packed 1/3/4 full, and how they are closed, how they are barcoded, and how should be the storage before it is given to the authorized waste recycler. This is how the barcoding is done by the Central Pollution Control Board, and very soon, the National Green Tribunal has asked Central Pollution Control Board to have a pan-India same guidelines, because Central Pollution Control Board has formulated one, but the stickers are state-wise, but you need to have the pan-India stickers. And then India also has a very active, tribunal, that is National Green Tribunal, apart from the Ministry of Environment, Ministry of Health, the State Pollution Control Board, which gives us recommendations, and the suo motu cognizance means it takes the PILs, instead of following the PILs, it files a suo motu, petitions itself, like if the environment is not the waste is not being handled properly. So for the equipment and supplies, we have, the standards laid down, the non-chlorinated PVC-free bags, how the bag strength should be, how the autoclave should be monitored, how often the microwave should be monitored. This is the contract which we have with the State Pollution Control Board authorized agency. Then you have, you need to give to your sanitation workers, your healthcare workers, doctors, nurses, and technicians the health checkup yearly, and the immunization, that is hepatitis B and tetanus. And India at present doesn't have the Genius vaccine for monkeypox, but if the cases increase, yes, definitely they are indicated for the healthcare workers, especially laboratory technicians and the waste handlers. Training, you need to have training and such interactive sessions, such collaborations, for, what are the best practices. You need to have your in-house training. You need to have what the other countries are doing as good practices. Take help of these government, there's the hand hygiene day, or, the patient safety week, or the Swachhta Pakhwada, or the environment, WHO Environment Day, or WHO Health Day, and take out these activities related to waste management. We have those poster competition for MBBS and other students. And monitoring, you need to have a checklist, and we have an in-house biomedical waste app also. It clicks the photograph, the mobile, and it takes whether it's fine or not. You're able to catch the department. The only issue with this app is you need to have a robust connection, internet connection. And, we post on the website the respective hospital data also. That much is the transparency, how much is which category waste. We share with the Pollution Control Board, post on the website, have an annual report also. And this is all to, thwart the attempts on pilfering or reuse of waste. And so we need to maintain our records on the quantity, record books, and barcoding, again, is a very useful app to track waste. And then pre-treatment of lab waste is recommended by, the sustainable technologies like autoclaving or microwaving. And then for certain waste which requires log 4 reduction, like slides and etc., which do not have live culture, we have those, sodium hypochlorite 1%. You have other non-chlorinated disinfectants, but till some suitable cost-effective replacement for hypochlorite is there. There are phenolic disinfectants also available, but slightly costly than that. Then COVID waste recommends, the double bagging to prevent the, the leakages, and for healthcare worker safety. And we are just labeling it so that it is disposed of this thing. So the second topic was what waste, which category. That was related to, all the infected waste goes into yellow category. The human, the animal anatomical waste, the expired medicine, the soil waste, the chemical waste, the PPEs, and the samples are made safe by pre-treatment, and then they are disposed of. And your hospital needs to have the effluent treatment plants, and you have neutralizers also available. The microbiology liquid waste is very, very important, and material safety data sheets you need to have of the chemicals, the drain disposal. You need to, have a balanced pH between 5.5 and 9.5. And this is the effluent treatment plants. Most of the hospitals, they have it in India, the bedded facilities. And this is there in most of the hospitals. The quality standards are laid down. So yellow is for the infectious and the soiled infectious waste. Red is for the infected plastic disposable. In India, instead of the electronic needle destroyers, we have shifted to the mechanical needle cutters to thwart the pilferages and so that they are and we use safety syringes also. So red is for the infected plastics, the ICU and the intensive care units, disposable plastic, they all go in red category. The lab waste is pre-treated by log 4 and the cultures are by log 6, that is by autoclaving and microwaving. So lab waste we are pre-treating in India, maintaining the standards laid down in the biomedical waste management rule. The indicators, the color indicator with each side and score test, and white is for the sharps. And then sharps we are using, like one needle, one syringe at a time, and sharp policy is there. Needle cutters are there, and for glassware we have this blue biohazard, cardboard boxes, that is more sustainable, or the plastic one, but we have given both options. And then what about the monkeypox waste? Like it is infectious, so the waste treatment, again, it is divided into as biomedical waste, and solid waste needs to be separate. And so they take it as category A waste, so pre-treatment at the level of the hospital and then disposal. And the monkeypox vaccines to lab technicians, waste handlers, and everything is based on the principle of circular economy. So that you have reuse, refurbishment, recycling after, authorized pre-treatment you do at the hospital level, and the treatment at the common facility level, and it is given to the authorized waste recyclers. And so this is surrounding the hospital. Also, we need to take care of the pollution. The National Green Tribunal has come out with that. And so points to ponder, urgent interventions they have done in terms of system capacity, greater resources, processes, rules and guidelines, their trainings, health checkup, interactions, records. In fact, that's waste stewardship. They are, the amendment in the guidelines, whatever comes up, it is to decrease the yellow category waste. We need to also focus on the home care waste categories. Remember that not all sharps can be mutilated. Combination of sharps and plastic, we are taking as sharp. E-waste, again, extended producer responsibility. We need to have, what we need is the third-party audits of the common facility operators, and because our ultimate aim is green and clean hospitals under Swachh Bharat, and under, like, for United Nations also, that is 2030 we have to achieve the sustainable developmental goal under WASH. That is water, sanitation, hygiene, and waste management and electricity by 2030. So thank you. So ultimately, I would say that waste management is, collaborative efforts of all the stakeholders on the principles of circular economy, whether you are inside the hospital or the pollution control boards or the state pollution or the central or the Ministry of Environment or the National Green Tribunal or the outside, the other countries. We need to have, waste partnerships and waste collaborations with WHO. What are the other good practices they are observing in other countries, and with CDC and other. Thank you. Yeah.
Thank you, Dr. Malini, for guidelines, principles, biomedical waste management rules. So is there any way to reduce the healthcare waste, and so that we can prevent the environment pollution from the waste management?
Yes, actually, I'm just...
So I think there are a lot of possibilities to minimize the waste, and especially also the plastic waste. Actually, I've been yesterday on an expert group meeting at WHO on procurement and supply chain. And there it was really called for reducing of plastic in the health sector. And even one of the speakers said we need to reduce plastic. We should not recycle because that's not serving the purpose, which I do not agree. But I think there are a lot of possibilities, at least to minimize the use of plastic, or to recycle, or at least to minimize the hazardous substances in the plastic. Because when we talk about plastic, it's not just the plastic, but there are all the additives which are in the plastic and which makes some of the plastics really difficult to recycle and to use. And there are still toxic elements in the plastic. And during procurement, we can already have a look to procure plastic which is less hazardous. For example, not to use any plastic which is containing PVC is one of the easiest thing we can do to reduce the plastic use, but also to substitute the plastic with reusable items. So there are a lot of possibilities to use medical devices which can be sterilized and reused, so to minimize the single-use items and go towards the reusable and items which can be processed.
Okay, thank you.
Because, India has, formulated the plastic waste management rules, like I just mentioned in my presentation, no single-use plastics, and then the hazardous chemicals should not be there, the nanoparticles or those which are there, they should not be there in that. And we have started that initiative in our hospital to prevent the use of single-use, those single-use plastics in our canteen and the other non-healthcare units in our hospital. But the main problem is the single-use devices that needs to be taken care of. And we are having the non-chlorinated plastic disposable bags as mandated in the rules and guidelines. And so that, when they burn the dioxins and furans, they are minimal. And then also we are also having, the plastic segregation, that is by the material recovery facility of the solid waste also we are doing at our hospital. That's one of the good practices, so that the plastic is recycled. Thank
you. And Dr. Malini, you were just mentioning barcoding of bags, which has become mandatory in the new rules 2016. So can you tell us why it is important and how it's done in brief?
Yes, the barcoding of healthcare waste is very important and crucial for, the healthcare waste tracking from cradle to cradle, like to prevent pilferage. And, two types of hospital level barcoding is there. One is at the common waste site level, and the other one is at the, ward level. But, the most cost effective is at the common waste site level. So most hospitals are using that at the common waste site level. And there are barcode guidelines from Central Pollution Control Board 2019. They have been revised. And at the hospital level, the waste bags, they are put on the weighing scale, which is connecting to the handheld device that's usually a mobile and which is connected to an online server of the various category, yellow, red, blue, and white, and which the server is linked with the healthcare facility, the pollution control board, and the common facility operator. And it's the responsibility of healthcare facility, and it is also the responsibility of the common facility operator to have the barcode label. It is both responsibility. And NGT has recently directed Central Pollution Control Board to have uniform, stickers for Pan India, so that the waste tracking can be done at the Central Pollution Control Board level. Because sometimes instead of the State Pollution Control Board tracking, it's better the Central Pollution Control Board monitors if they have a uniform stickers and the barcode.
Yes, I can. Thank you.
Okay. So tell me why is communication, as far as healthcare waste management is concerned, why is communication and collaborations are important within the hospital setup?
I'm sorry, may I give my presentation?
Yeah. Actually,
we have discussion now.
Yeah, so she's asking first, she will present and then you could ask the questions. Fine. Yeah. Yes, you could just say that.
Yes, thank you.
Yes.
So thank you, and good afternoon, and I appreciate the invitation to speak, and apologies for the slight hiccup with the joining online. So I am Ruth Stringer, and I'm the International Science and Policy Coordinator for Healthcare Without Harm. So my talk is about waste stewardship and circularity. Next slide, please. So Healthcare Without Harm is works with strategic partners around the world to develop and implement strategies and initiatives to transform healthcare worldwide so it reduces its environmental footprint. We run the Global Green and Healthy Hospitals Network, with over 1,900 members in more than 80 countries, representing over 70,000 hospitals and healthcare systems that are using innovation, ingenuity, and investment to transform the healthcare sector and foster a healthy, sustainable network. Next slide, please. I'll keep this quick. Right? So in India, physicians can join the Doctors for Clean Air and Climate Action, which is an initiative from the Lung Care Foundation with Healthcare Without Harm that brings together doctors from every state in India to advocate for clean air. So next slide. As part of our work, we also, you've moved too far.
Now it's open house. You can ask questions.
Sorry, I had a just basic question. Of late, I was told that the base segregation norms have been little changed based on the material it is made of. For example, if we take our PPEs like masks, head caps and aprons, should it go into yellow because it is soaked or infected, or should it go into red?
Yellow.
Because all these have a material of plastic in them. So
they are of mixed material, but then after the deliberation at the ministry level, it was decided that all these materials will go into the yellow bag.
Okay. Another thing is the discarded medicines. For example, if we take liquid medicines, we discard the liquid into the sink, and then if it is made of plastic bottle, it should go into yellow or it should go into red?
This, I think, we'll ask the panel. Dr. Malini?
Hi, yes. You're asking that if there is a liquid, like let's say it's an antibiotic solution in a plastic container, that's the question?
Yes, ma'am.
And it's a plastic container.
So, okay, that I got it. See, you have a yellow category waste where you're putting the soiled, putting the soiled cotton. So you just pour off your antibiotic solution in that soiled cotton, which is already there in the yellow bag, and put the plastic bottle back in red.
Okay. So if it is a glass bottle, it will go into the blue?
Yeah, but do not drain off the antibiotic solution in your wash basin.
Okay. It should be poured into the yellow soaked waste.
And I can ask, there are two experts, Ute and Ruth. I can ask them, there are certain the syrups, like vitamin syrups and all that, which are, environment friendly. They are effluent safe. You can just pour them off the wash basins, the vitamin syrups and all that. And Ute and Ruth, can I ask you two questions? What are the other things which are sewer safe, which we can pour off directly apart from the vitamin solutions?
I think this is a question for Uta. She's been working on this recently.
Okay.
Thank you, Ruth. But I wanted to leave the floor to you. But however,
I would definitely like to have WHO opinion also, because
No. Actually, the pharmaceutical waste. When we talk about pharmaceutical waste, there are a number of hazardous pharmaceuticals. But when we talk about the non-hazardous, we have non-hazardous vitamins. We have non-hazardous syrups, for example. But what is a large amount of non-hazardous pharmaceuticals are the intravenous salty solutions. Yeah, and this is quite big, and it is not hazardous and need not to be disposed as such. However, we need always to ensure that also the non-hazardous intravenous bags, for example, cannot be reused by any waste workers or waste handlers, so that the safe disposal is guaranteed.
Exactly. Thank you, Ute, for your valuable thing. So as of now, we have, vitamin syrups, which are sewer safe. They can be drained off in the wash basins. And then, as she has mentioned, that we need to, stop the pilferages so that the waste worker is not able to reuse them. So keeping that in mind only, I have just mentioned that if it is an antibiotic solution, you pour it off in the yellow, in the yellow bag, and the rest, the plastic will go as plastic as red, so that, after proper treatment and sustainable technologies, it can be recycled.
Okay. Thank you, ma'am. Thank you. Any other question, ma'am? And if it is a glass bottle, say if it is a glass bottle, then you, once you pour
Yeah,
it,
if it is glass, then it will go in the glass
into the
category.
glass container only.
Yeah.
There is also a very narrow margin into broken glass bottles, vials, whether they come under shops or do they go into blue?
They have a separate container for glass, broken glass, they have a separate containers.
For glass, you have, two kinds of containers. One is the cardboard box with the biohazard sign blue, and the other one is plastics. To be cost effective and have a sustainable option to decrease the plastic use, we have kept the cardboard box also for glass. But we have given both the options.
You can choose whichever your hospital afford. So plastic ones
Yes.
are little costly, but you can use the cardboard box also with blue markings. Anyhow, yes, ma'am. You please introduce yourself first.
I'm Dr. Priyanka from Rich Candy Hospital, Mumbai. I have a question regarding
Can
needle
you be
cutters.
little louder, please?
I have a question regarding needle cutters, whether they are still being allowed to use because it is not specifically mentioned in the rules. What is mentioned is puncture-proof containers. So most Mumbai hospitals now are moving towards these puncture-proof containers and needle
Can
cutters.
she repeat her question on the
It's
mic
not-
by
it's
coming
not-
on the dais, because her
You-
voice
you
is
please-
not audible
you please come
to
here.
any of the panelists. Yeah.
Are the needle cutters allowed now instead of puncture-proof containers?
I cannot get
See-
your question. You come here, you speak on this.
You come to the dais and speak. Yeah.
My question is regarding needle cutters. Are these now allowed to use instead of puncture-proof containers for the needles? Because mostly now
Yes.
the companies are not manufacturing these needle cutters as it is not specifically mentioned in the rules.
No, it is mentioned.
Yes. See, the needle cutters, the electronic needle destroyers are phased out because, they have the biosafety and they have, the healthcare worker safety issues, and the mechanical needle cutters, they are preferable. And this is, to thwart the pilferages, because in India, you have reuse of especially needles, syringes, and the medical devices. To cut short that, the government of India came out with that you have to cut needles, and that because in India, a lot of outbreaks of hepatitis B and C virus and at times HIV also were happening. So therefore, these guidelines were made strict. 2016, the electronic needle destroyers were phased out because of the fire safety and the biosafety issues, and we shifted to mechanical needle cutters. So cutting of needle is mandatory.
Cutting of needles mandatory, it is mentioned in the rules, but electronic part is phased out because of... No, so ask them to please read the rules.
And we can ask the question to other panelists, like,
Any other question, please?
Ruth
Yes.
and Ute also, they were,
You ask the WHO expert.
recommending, yes.
You can please come.
Yeah, am I audible to you? Am I audible?
Yes.
Yeah, see, this is regarding that cutting of needle is written in the guidelines, but it is not mandatory as such, because we are using the needles which are coming from BD, which comes with a auto cover in that. Once we use that needle, the above plastic will cover the front part and it get locked.
Yeah,
So there are no
you're
chance-
absolutely right. When I mentioned in my presentation also, when you're using, safety syringes, so that time you are not mandated to cut the needle because the needle completely goes
Exactly.
out. And, during vaccination, COVID-19 vaccination and earlier immunization programs also of the states, the safety devices, the syringes with safety devices, needles were there. And there you are not required to cut because the needle completely goes inside, and that we are treating as red category waste. I did mention in my presentation
Yeah.
about the safety
Yeah.
needles. Yes, you have a point there.
There is no role of hypochlorite also now.
No rule.
Yes, there is no role of hypochlorite because, the pre-treatment is only the lab-based pre-treatment we are doing here. Rest other the common facility operator is doing. Yeah.
Ma'am, even in case of, since we are using puncture-proof containers, even where the needles are not safe, like...
Cutting is mandatory.
Mandate.
There is a pilferage industry to thwart that and for reuse of needles.
So your needle, these puncture-proof containers, they can be easily opened and somebody can take the needles. So it is, as far as possible, it's mandatory to cut the needles. Otherwise, if it is a safety syringe, it's not required. Otherwise, it is mandatory.
So we need to have both needle cutters and punch-proof
Yes,
containers.
yes, both are mandatory. Both are mandatory. Punch-proof containers are also mandatory, and needle cutting is also mandatory. Clear?
Thank you.
Any other question, please? It's open to house. I think there are so many questions whenever there is a workshop on healthcare waste. So, okay, thank you, panelists. Thank you, Dr. Ute. Thank you, Dr.
Thank you.
Ruth and Dr.
Any
Malini.
other questions for the panelists?
It was wonderful talking to you. It was
Sir,
wonderful.
we can ask like WHO and the healthcare harm speakers, like related to the disposal of healthcare waste from a case of monkeypox.
Thank
Yeah.
you so much for coming online and
Okay.
enlightening our audience. And thank you very much. This was a wonderful panel discussion and hope to see you sometime in future. Thank you. Thank you very much.